Pain. Factors that influence pain, mistakes while healing an injury, and recovery tactics. What is pain? Now, this is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. It does not just involve the physical, but also emotions and other factors. Not all types of pain are the same and have different causes, symptoms, and treatment. Acute pain can also become chronic pain. Pain is a signal to let your body know something is wrong and to prevent further damage. Factors that influence pain. Number 1, not living a healthy lifestyle. Not sleeping well, lack of quality nutrition, and poor movement practices can all influence pain levels. These will all weaken the nervous system, which will heighten pain. Number 2, emotional stress. If you have a lot of emotional stress on top of an injury, it's going to take longer to heal. This is because the stress of any kind takes resources from your body that could go into healing. Number 3, the mind. There is something in science called the placebo effect. This is used for clinical trials as the control while patients are given nothing, but they believe they're given treatments. When the patients believe they're receiving treatment, they get better an average 33% of the time. This is the power of our mind. Something less talked about is the nocebo effect, which is the opposite of the placebo. This is when you're given a negative injunction, whether it's 6 months to live or an incurable disease, immediate fear arises in your body and responds accordingly. A thing that you believe will happen will largely influence the outcome. You have the power to be well, but the power starts in our mind. Common mistakes while healing an injury. Number 1, immobilization. Your body requires movement in order to heal itself. There are some instances where full immobilization is necessary for a severe injury, but for the most part, active recovery is the best option. Progressively get better by moving, but not pushing past the pain threshold. Number 2, icing. Now, icing has been used for a long time for injuries, but it's actually not helping the way that we think. The idea is to reduce inflammation so the body can heal. What tends to happen is the tissue and its surrounding fluid gets frozen to the point where the inflammatory products can't get out, and the healing factors can't get into the site. Also, too much cold therapy after exercise can inhibit recovery because you would be blunting a hormetic response to exercise. Recovery tactics. Number 1, proteolytic enzymes. Now, these are protein digesting enzymes that get into the bloodstream and break down fibrinogen, which is a waste product of muscle breakdown. These are best taken on an empty stomach so they don't digest your food instead of helping you recover. Some great brands are Kion Flex and Masszymes. Number 2, EAAs. Essential amino acids are critical for recovery. This is because all 9 EAAs are required for muscle protein synthesis. Most foods have a variety of amino acids, but they're low utilization profile. Eggs are the highest, which is at 48%, which in comparison to an EAA supplement, it's 99%. Number 3 is sauna. Heat exposure has been shown to increase muscle hypertrophy or the muscle strength and mass. It also helps you to keep muscle better while you're not exercising. Sauna exposure causes thermal stress in the body, which causes the body to release heat shock proteins to increase cellular antioxidant capacity and enhance antioxidant mitochondrial function. All right, everyone. Thank you for tuning into the show. For more, you can head over to anthonygastella.com for articles, coaching, and other free resources. Also, if you can, leave a review for the show, let people know what you think, and I would appreciate that so much. Support the mission of freedom. Thanks for being on this mission with me, and I promise to give you more powerful, empowering, great content to help transform your life. Thanks for tuning in.